I have myself and Ritu here from Public Counsel, and I'm just going to share my screen so you all can see our PowerPoint here, so we can get into that. We're going to run through a quick PowerPoint with some of the basic legal information that will help protect your childcare from COVID-related issues. And then we're going to leave a lot of time in the hour open for questions, because we know that some questions might be specific to your practice. And we want to make sure that we, as childcare providers, you all are the experts of the issues that you're having. And so we want to make sure that we get the answers to you for the questions that you have specifically. So if you have questions, you can also put them in the chat while we're presenting. I'll keep an eye on the chat and we'll ask those questions when we come to a pause, or if it's in the middle of a specific section, we'll also ask those questions during that time. Somebody asked, will we have access to the slides afterwards? And yes, we will provide the slides to you all. They're pretty short, so some of the stuff that we're going to run through, you won't necessarily need to have access to the slides, but we will provide those afterwards as well. So I'm going to turn it over to Ritu, who's going to introduce Public Counsel to you, so you're more aware of what we do. And that way, if you have to reach out to us for anything, you know how to access our services. Ritu, if you want to go ahead.
Hi, everyone. Yes, sure. Hi, everyone. Thanks for joining us this evening. Just quickly, Public Counsel, for those of you that don't know, we're a legal nonprofit organization located in Koreatown, very close to downtown LA. And we provide free legal services to low-income people in LA County. Public Counsel has 9 practice areas, one of which is the Community Development Project. And within that project is the Early Care and Education Law Unit. So for those of you that aren't familiar, our unit, I think since the mid-1980s, has been providing free legal services to childcare providers, as long as you qualify, which means you'd either be low-income yourself or serving low-income children. And the types of things we've helped with in the past are like landlord-tenant issues, help drafting your parent-provider contract or your handbook. We get a lot of employment law questions, like providers who have questions about hiring or firing employees. Some providers have asked us to review their leases. Others have asked us about like issues related to like getting a zoning permit. So we definitely try to help with the variety of legal issues that come up in the day-to-day operation of your business. And at the end of this training, we'll give you our intake line number, which is the best way to reach us if you do have questions. Now I'll move on to the next slide, which is just a quick disclaimer, which just briefly says that, this presentation is a general overview of the issues involved in operating your childcare business. It's not intended to provide you with legal advice. It's not creating a lawyer-client relationship, but definitely if after this training you have more questions that we weren't able to answer today, please call our intake line and then we can give you one-on-one advice. And now I will turn it over to Dee to start the presentation.
Thank you, Ritu. So we're going to jump first into the LA County Department of Public Health resources. So I'm not sure if you all are familiar with these resources, but I'm going to post the link that we're going to look at in the chat right now so that you all can follow along. But the Department of Public Health has put together a lot of resources on guidance on how to follow the COVID regulations for businesses and specifically for childcare providers. So if we go ahead and click, let me see if I can pull that up for you all. We're going to run through it briefly just so you know what resources are available, and then we'll go into how to integrate those into some of your practices. So the first most important document on the resource page is the guidance document. They've recently reformatted this. So if you've taken a look at it previously, they've reformatted it into a checklist, which I think is more useful for everyone in order to implement some of the stuff that they're requiring businesses to do and childcare providers to do. So the checklist, as it says, covers workplace policies and practices, measures to ensure physical distancing, measures to ensure infection control, communications with employees and the public, and measures to ensure equitable access to critical services. It's a pretty extensive checklist, and so if you follow it step by step, you're better ensuring that you are following the guidelines, protecting yourself from legal recourse and any kind of liability that might pop up. And it is a way, since it's so detailed, also a way to help stop the spread of COVID within your childcare programs. So this first section here, again, is workplace policies and practices. So it's a detailed breakdown of those step-by-step guidance, and it runs through the whole checklist. So if you take a while to read through it, I'm sure a lot of you have been implementing most of the stuff on here, but it is a more detailed version to help you make sure that all the details are checked off. So then if we go back, another one of the important documents on here is this plan. So this plan is a way to approach any kind of like COVID exposure. And it's a management plan, which is good to have in case there's exposure. You're following the guidelines again and the guidance put out by the Department of Public Health. And that way you can make sure that you eliminate this risk of spread of COVID and also protect yourself from any kind of liability from not following the guidance that the Department of Public Health has put out. So if you read through these things, there's a lot of good resources on there as well. And then the last one that we have on our slide, I actually think that was the last one. But so we wanted to make sure that you all have access to this. Through that link, we'll also have it in the PowerPoint where you can be linked to this if you haven't seen it already. Again, I'm sure a lot of you have seen it, but we want to make sure that the information there that you have access to, you can read through all of it and try your best to implement it within your child care program. Let me switch back to the PowerPoint. So part of an option that child care providers have is the ability to have parents sign liability waivers. Ritu is going to talk a little bit more about the enforceability of liability waivers and some of the things you want to have integrated into those waivers if you're going to make use of them.
Hi, yeah, so a lot of providers have come to us recently asking if we can help them draft a liability waiver. And for those of you that aren't aware, these waivers basically are a document that a parent would sign, basically saying that, you know, they assume the risk of sending their kids to daycare, and that they, so that they assume the risk of sending their kids to daycare, and if their child or one of them were to get sick because of attending the daycare, they will not sue the provider over such situation. And so a lot of people have asked us if we can draft these waivers, and we have connected them with pro bono attorneys to do that. However, I just wanted to talk about the enforceability of these waivers. So, you know, COVID is definitely a new area of law, and we don't know how judges are going to interpret such waivers. It's possible that a judge could throw it out and say, you know, a parent doesn't have the ability to sign away their right to sue you if their child got sick at your daycare. But we do feel that they can serve a practical deterrent effect, meaning like if someone signs it, at least they are on notice that there is a risk of sending their child to daycare, and they may think that they're not capable of suing because they've signed it. So it may have that effect. So it may deter some people from suing, and at least it puts them on notice that there's a risk. In any effect, if you do have a waiver drafted, you want to make sure that it's really clear and it's specific to COVID-19, that you still take reasonable care and you follow, you know, the LA County guidelines for the COVID regulations. You know, do not engage in gross negligence or doing something reckless. And you basically state that you will be complying with all local health guidelines. So, you know, in summary, what I'm saying is that we don't know if these documents will be enforceable, but a lot of providers are choosing to have parents sign them anyways. And if you need help drafting one, that's something we can definitely do as long as you qualify for our services. And in general, you know, these documents have to be very clear and specific, and they can only cover, you know, they cannot cover acts of gross negligence or reckless conduct. And, you know, in any event, you should act reasonably and with, you know, proper care. We also are encouraging everyone to get liability insurance if they didn't have it. However, I am aware that some insurance companies are not going to cover COVID-related incidents. So if you were to get sued for someone contracting COVID at your facility, your insurance company may not cover that. And definitely if people have questions, please let us know. We can also address them at the end of the training.
Sorry, I'm just having issues unmuting myself, but should be fine now. We wanted to cover the opportunity of drafting a liability waiver just so that the importance of the guidance from the Department of Public Health is also highlighted. And so a liability waiver, as Ritu mentioned, would state that the child care provider is acting reasonably within the guidance and the guidelines put out by the Department of Public Health. And so it's important to make sure that you're reading thoroughly through that guidance and understanding what is required of child care providers and businesses more broadly. So next, we'll talk about parent-provider contracts and handbooks. So many child care providers and at-home child care providers should have a parent-provider contract or handbook that outlines the parent and provider relationship. If you do not have one of those, we will be talking more extensively about it, and we'll be providing after the training a sample parent-provider handbook with COVID-19 guidelines added into it as well. So if you have one already and you want to just add the COVID guidelines to it, we're going to go over some of the key areas where that language should be updated, and that'll be included again in that sample. But we do ask, or we do recommend that, or strongly recommend that child care providers, when they're drafting their parent-provider contracts and handbooks, work directly with an attorney to draft a contract or handbook that specifically fits their child care practice. So that way it's tailored to your practice and better fits the program that you're providing. So after this, as Ritu mentioned, we'll include an intake line where you can call us. If you qualify for our services, we can help you draft one of those specific to your program. So some of the key areas where language should be updated is the drop-off and pickup procedures, the child illness policy, closures due to COVID-19 and the fees already paid, and the reasons for immediate termination. So we'll jump into the first area here. So this is sample text for drop-off and pickup procedures. I'm going to read through it quickly. You all can read through it as well, but again, we'll send out the slides and it will be in the sample handbook that we send out as well. So it states, in order to prevent the spread of COVID-19, we ask that parents bring their own pens to sign their children in and out. Parents will be asked to wear masks or face coverings while dropping off, picking up, or visiting the family child care, and to maintain at least 6 feet of physical distance from other families to the extent possible. Parents will also be asked to meet at the facility entryway for pickup and drop off of children. Please make all visits as brief as possible. Parents, guardians, or authorized individuals must hand the child to the provider. If you're feeling sick as a parent, even with mild symptoms, please arrange for somebody else to drop off and pick up your child. Before dropping off and picking up your child, as well as when you get home, make sure that you and your child have washed your hands thoroughly. To the extent possible, limit carpooling and have the same parent or guardian drop off and pick up the child each day. Failure to abide by these COVID-19 guidelines will result in immediate termination from the child care. So the person who asked if we can forward the Elsa, we will be forwarding or sending the PowerPoint to Alyssa after this training, along with the sample parent-provider contract that has this language within it, and then it will be forwarded to the participants of this webinar today. So everyone will be able to have access to that. Let me just pull up. So the other area of focus to change your handbooks would be the child illness policy. And basically, you're going to integrate the Department of Public Health guidelines into your child illness policy. So if you have one already, you want to make sure it's updated for COVID-19. So that way you are creating notice for the parents on what the expectations are, and also protecting yourself when you need to potentially terminate a child from the program. So this language reads, children with symptoms of COVID-19 must remain at home for a minimum of 10 days and 24 hours after the resolution of any fever without fever-reducing medication and the improvement in other symptoms. Symptoms of COVID-19 may include shortness of breath, new loss of taste or smell, nausea, chills, headache, muscle aches, and fatigue. Children who have been exposed to somebody with a respiratory illness must stay at home for 14 days to monitor symptoms. If no symptoms appear after 14 days, the child may return. Children who are sick but do not demonstrate symptoms of COVID-19 may return 24 hours after symptoms disappear. If your family travels more than 100 miles from your residence or by plane, we require that your child take a COVID-19 test upon his or her return and only resume attendance at the family child care once the child receives a negative test result. Failure to abide by this COVID-19 policy will result in immediate termination from the child care. Days when child cannot attend the family child care due to the above will be charged as though care were provided. We ask that parents help us in ensuring the health of children and staff by monitoring symptoms, including daily temperature checks. The third provision covers closures due to COVID-19 and the fees already paid. So this provision is going to help protect you from any kind of unexpected closures due to COVID-19. So if potentially you become sick or you have to close to clean because a child is sick, it will protect you from parents requesting their fees be returned. So the text reads, it is possible that the family child care may temporarily close beyond the holidays and vacation days listed above due to unforeseen circumstances, including but not limited to a pandemic, public health emergency, natural disaster, etc. If the family child care closes due to any of these above circumstances, there will be no refunds of child care fees paid for the month that the family child care closes, and parent must continue to pay child care fees during the temporary family child care closure due to the above mentioned unforeseen circumstances in order to hold your child's spot in the program. And then lastly, we have reasons for immediate termination. And so within the circumstances, such as a child contracting COVID-19 and not following the guidelines, you want to make sure that you have the option and resources available to be able to enforce the rules within the handbook and terminate a child from the program if necessary. We understand that this is not the best option since you want to retain children within your program, but in case children and their parents are not following the guidelines and risking the health of others, this provision will be helpful. So the provision reads, provider may terminate child's enrollment in the family child care home effective immediately if any of the following conditions arise. First, in the sole judgment of provider, the child's behavior or the parent's behavior poses a significant threat to the physical or mental health or well-being of one or more of the other children at the family child care home, the provider or other persons on provider's premises, and provider is unable to reasonably eliminate the threat. Second, the parent fails to comply with COVID-19 guidelines mentioned in this parent-provider contract. 3, any payment owed by parent to provider under this contract is not paid within 3 days after such payment is due. And 4, the child is picked up late more than 5 times in any 30-day period. So that's most of the updated language for the contracts. Again, as I mentioned, we're going to send out a sample parent-provider contract with this language already in it so that you can see how it integrates into your contracts. You can also look at the other language within the contract to update your parent-provider handbooks if they need updating as well. But we did want to bring you those 4 key provisions so that you are ensuring against, so that you are letting parents know kind of what is expected of them and ensuring that you have the ability to move forward if there is some risk from the children or parents that are within your program. So we wanted to keep the last half of the webinar today for questions and answers so that we can answer your questions more specifically and get that information to you. So if you have questions, you can feel free to put them in the chat box or you can ask, it might be best to maybe raise your hand on if you have the raise hand option. I'm actually going to go to the next slide so that you all have our contact information, and then I'm going to close the presentation so we can see everybody's faces more easily. So if you want to go ahead and write down our phone number here, this is how to contact our intake line. We will also send out the PowerPoint and the handbook together. So you'll see it on the PowerPoint, and we'll give this number also to Alyssa so that it can be more easily and readily accessible to everybody. Okay, so I think we can go into the first question, Ritu, since there's some questions in the chat, but one of the questions was, how do we present this updated handbook to parents?
Yeah, so if you have families in your care who have already signed like a previous handbook or contract, that old contract or handbook might say something about modifications or amendments. I don't know, it depends on what your contract says, but a lot of contracts will say, we'll give you 30-day notice of any changes. So I would definitely let parents know that you have a new contract or handbook that you would like them to read and sign. And you can give them the 30 days notice, or if your contract doesn't say anything about that, you can just give it to them as soon as possible. I would try to go over it with them if you can. I don't know, if you have a lot of families in your program, that will be hard, but if there's a way to go over it with them or have them initial each provision, that might be helpful, because you want to make sure they really are understanding like the reasons behind these COVID provisions and why it's so important for our communities to kind of like, keep the 6 feet distance and wear the mask. So yeah, like I said, either you'd give them the 30-day notice that there's going to be changes and present them with the new handbook to sign, or you just give it to them immediately if your old handbook doesn't say anything about, changes. Hope that answers your question.
And Ritu, the next question is, is handbook and contract the same thing?
So the way we viewed it at Public Counsel, contract is like the document that has the main terms between the parties. So it talks about the hours of care, how much the fee is, when the payment's due. It talks about termination of childcare. It talks about, illness policy and, the policy for absences, whether you're going to charge the full fee. It talks about vacations. That our sample contract has all of that in it. The handbook we see kind of as like a secondary document, and a lot of the small family child care providers we work with do not even have a handbook, and I don't think it's necessary. The handbook is, in my view, more kind of relevant for like bigger programs that have a lot of policies about like different things, like maybe about how they celebrate like birthdays, or how they, if they have something specific about like their curriculum or their philosophy, if they have information about, field trips, and like, to me, it's like where you put ancillary policies, but the contract's kind of the main document. So after this training, we will be sending over to all of you who attended our sample contract, which we've always had for many, many years, and it's on our website. And I believe a lot of R&Rs use our contract too. So you may already be using a version of, our sample, but it now has the COVID provisions in it.
Another person within the chat asked if we have it in other languages.
We have the regular contract in Spanish, but we haven't added the COVID provisions to it yet, but we can do that, this week.
Okay. And then Mirabelle, you had your hand up. If you want to go ahead and unmute yourself, you can ask your question, please.
Yes, currently I already have my provider contract, which is drafted to me by Public Counsel, and thank you for that. I've had this for 15 years now, but of course with the COVID-19, it's a different story. I just don't know how will it go regarding, because I accept there is a deposit from some families, and I don't know how to go about this. Well, some of them waived it already and told me whenever I'm available to pay for it, I can just take care of the children back again. But there are some who were asking for a refund. I don't know how will I deal with it when in the contract it doesn't say that I can return it in cash, but I can give services to them.
Yeah, that's something really specific. I would prefer to like, if you could email me or call me after this training, maybe tomorrow, and I can look at your contract and I can see what it says, and I can give you some suggestions on what to do if people are asking for a refund of the deposit.
Thank you so much. I will be doing that. Thank you.
Okay.
I'm going to, Ritu, can I put your email in the chat here?
Yeah.
I think it was on the slides as well. Yeah, I'll go ahead and put your detail.
And yeah, just to mention something, when COVID hit in March, a lot of providers were calling me saying, they unexpectedly had to close their doors and they didn't know what to do about charging families, childcare fees, because on the one hand, maybe many of them weren't providing any service anymore, or maybe they're providing a small service like virtually. But on the other hand, if they didn't charge any fees, they wouldn't be able to ever open again. So many people were asking, are they legally allowed to charge a fee when they're closed? And that was coming up a lot. Technically, it's really dependent on what your contract says. So that's why we suggest you include something in their contract that says if you do have to close due to COVID, what are you going to do about charging fees? Some people may decide, okay, we're closed, we're not going to charge anything, because maybe they think that's the fair thing to do. Other people may say, oh, we're going to charge half, or I'm going to charge the full fee. But whatever you decide, put it in the contract so parents are aware of your policy.
Mirabelle, you have your hand up again. You can go ahead and ask your question, please.
Yes. Okay. Since we are discussing that, there are a number of hours that we still work. We are physically closed. We offer the distance learning in the first few months of the COVID, but of course the parents did not last. They only lasted for 6 months to be on the distance learning. During that distance learning, we as a provider are especially with a government agency paid the government agency that they are servicing, they wouldn't want, they doesn't like, there are only 30 days that they're going to be paying for you with that. And I don't know what's our stand on that one. Since we offer distance learning and they wanted physical services, is that the one that we just can offer to them? I mean, but I did 6 months or 7 months of distance learning with these children, and they are not accepting.
I mean, so the government has their own stand. I think their rule was if you're physically open for in-person care and people aren't coming due to COVID, they'll still pay you for those children who get a subsidy. But yes, if you're physically closed, they didn't want to pay for people who aren't coming. So obviously we can't change what the government's rule is, but for the people paying privately, or even if you want the people who pay with the subsidy to follow this rule, you just need to put it in your contract, whatever you decide. So if you decide, okay, when we close physically, I'm going to be providing virtual care and you have to pay for it, whether or not you decide to use it, then put it in the contract. But if you think that's not fair, then, just whatever it is, make it clear in the contract so later parents can't say, oh, I didn't know that was going to be the rule. But I can understand why for parents it's not the same to get virtual care, because some parents go to work physically and they need someone to watch their kids physically, and so virtual care is not an option, especially if your child's really young. So although I understand that you're providing a service, to them it might not be equivalent, and so that's why they decide to not go forward with that.
All right. Thank you. I'll be in touch with you, Ritu. Thank you so much.
Yes. Let's talk soon and we can talk about it more.
Thank you, Ritu.
Thank you, Maribel, for your question.
And I don't know if we have questions on this, but another thing we heard in another training that we gave a few weeks ago was that some providers are worried that, they're complying with all the COVID rules. They're keeping their facilities clean and, they're trying to sanitize and make sure people aren't coming sick, but they're frustrated with parents who may not be following some of the stay-at-home orders, or some parents who may be gathering with other families on the weekends or not following the rules. And so some providers are frustrated with them. They don't know what they can do. And so to that question, what Dee and I were saying is that it's tough because, a lot of this is on your honor, right? The public health department is saying, please, do not do these things. And no one's going to necessarily give you a ticket if you violate it or, watch what you're doing 24 hours a day. So it is on your honor. So I think as providers, it's tough because all you can really do is educate the parents about why it's important to follow these rules, why this COVID disease is dangerous and how we need to follow these rules to contain the spread. And yes, you can have policies in your contract that say, if you do violate any of my COVID rules, I'll terminate care. But I understand it's not easy because, maybe you're barely making ends meet and you don't want to terminate care because you need that money or you care about the child. So I get it. It's not like an easy decision, but in my mind, there's not so much you can do other than educate the parents why it's important to follow the rules and, have repercussions for if they don't follow them. Some providers have been having parents sign like a COVID pledge, where it's like a separate document that just kind of goes line by line, says like, I as a parent, to my best of my ability, I will try to stay, 6 feet away from people. On the weekends, I will try not to go out unless it's essential, and have them initial next to each line. Again, you could have a parent sign that, but maybe they just completely, don't follow it on the weekends. But for some providers, it makes them feel better to have parents look at that and sign it. So that's another document we're going to prepare a sample of, and we can send it out to everybody.
Elizabeth, you had your hand up. I'm not sure if you still have a question, if you wanted to ask that.
Yes, I have been open throughout the whole year. I never closed up to last week. Paris said, we wanted to take the test because we have been open. We had no symptoms at the house or anything. So we took the test and it came out that we were positive. Now, my question and concern is, now that you're saying that we could be liable for some kind of repercussions from the parents if they get infected, if they got infected at my daycare. Now, we try, like you said, we guidelines, we make changes, we try to follow CDC guidelines as much as we can, and we tell the parents. So how would that, now I'm more nervous, like, wait a minute, what if it didn't happen with us, but you brought it to me? I mean, how?
Yeah, so the thing is, so if anybody tested positive, right, there's rules about like informing everyone and, potentially closing down or cleaning. There's all these rules about what to do. So you as a provider, you can follow those rules, and that's good to do that. But at the end of the day, if you were to get COVID, or a parent were to get COVID, or a child were to get COVID, like, people can sue for all sorts of things, right? You could sue a parent saying, oh, you weren't following the guidelines on the weekend and you got COVID and you gave it to me. And then a parent could sue you saying, you had COVID and my child got it at your daycare. The thing is, no matter if you sue or not, you have to prove it in court, right? You have to prove to a judge that this person caused you to have it. So like, that's not an easy thing to do, right? So when you try to prove it in court, you're going to have to show a series of events that prove to the judge with evidence that like this person is responsible for you contracting the illness. So while as a provider, you do have that risk of people potentially suing you and say, I got the illness at your daycare, it doesn't mean that they're necessarily going to win their case. It doesn't mean, that like you're going to have a lot of lawsuits. I'm just trying to bring attention to the fact that you could be sued. You could have parents sign these liability waivers, and maybe by signing it, the parent will think, oh, I can't sue this provider, even though technically, maybe this thing they signed wouldn't have been enforceable in court. So it does sometimes serve that practical deterrent effect where it makes parents think they can't sue you. It also puts them on notice that there is a risk to sending your kid to daycare, and, they need to be aware of that. So basically what I'm trying to say is, yes, there is a risk to running a business in this COVID area, whether it's a restaurant or a daycare or, another type of business. Someone can say that they got sick in your daycare and they could sue you. But I think at this point, if I was a provider, what I could do is I could try to get liability insurance, find out if the insurance would cover anything like this, which I think is unlikely, or that's what I'm hearing. A lot of insurance companies are not covering COVID-related incidents. I would have parents sign a liability waiver, and then I, as a provider, would just follow the guidelines as best as I can. If someone got COVID at the facility, I would definitely notify everyone as I'm supposed to. I would close if I had to, every day doing whatever I'm supposed to do based on the guidelines. That's all you can do, if you choose to remain open at this time, which obviously a lot of daycares, are deciding that that's their only option, because otherwise they'll just go out of business permanently.
Thank you.
Yeah.
Tom, you had your hand up. Did you want to go ahead and ask your question?
Oh, yes, thank you. Kind of along those same lines, what can you give us an idea about what the exposure is like liability wise for providers, and the guidances that get followed? So for example, there's the travel advisory, and if a family travels outside of California, they're supposed to quarantine for 14 days. They come back and they still put their kid in childcare, even though we asked them not to. So how would something like that work in terms of, the guidance from LA County Public Health?
I think in terms of travel, we do have a provision in our sample where you say if you travel like by plane or more than X amount of miles from your home, we ask that you not return to the daycare for like 14 days from when you get back, or that you have, you take a test and you confirm with us that, you were negative before returning. Again, like you can't ask necessarily to see a copy of the test, but you can have something in your policy like that, and you should enforce it. But again, it's like going to be on the honor of the family to tell you like, yes, we traveled and yes, we took the test, right? Like you're not going to be able to like be an investigator and know that they went somewhere. So that makes it tricky. But if they do go somewhere and you're aware of it, you should enforce this policy of them not being able to come back for a certain amount of days. And you should make it clear in your contract that you can charge them during that period that they're at home.
Good, thank you.
Sure.
I didn't want to, at the beginning of the presentation, go over the Department of Public Health guidance too extensively, because I assume that many of you have read through it. I hope that wasn't an incorrect assumption, and I'm wondering if people want us to kind of go over what's included in there, you can let us know so we can, quickly summarize what's also included in there. But otherwise, I'll just include the link again so you all can take a look at it. But it is worth reading through. They've made some updates as well that are informative and can help you better set up your daycare program to follow the guidelines as well. Are there any other questions from people? You can also feel free to type them in the chat, raise your hand, or if you don't have the raise hand feature, you can also just unmute yourself and go ahead and ask the question. Tom, I see your hand up. If you want to go ahead and ask your question.
So yeah, following up on that, well, first of all, the LA County Public Health guidance is the guidance that we should be following since we're in LA County, as opposed to California Department of Public Health or CDC guidelines. So that's one question. And then the second question would be, as LA County Public Health updates its guidance, do we need to follow suit with our contracts and our handbooks as they make their changes?
Yeah, I mean, I think for providers down here in LA County, I would follow the LA County Department of Health guidance and then licensing guidance if licensing has any other guidance. And in terms of updating your policies, yeah, unfortunately, you will have to update them if the county updates their documents or their rules, I guess. So what some providers are doing is they have a separate policy handbook for COVID, and then they have their regular contracts. So they're just giving parents the COVID policy as an addendum. This is what's going to go, these are our rules right now during COVID, but once and if COVID ends, we'll go back to our regular rules.
Just in case, will this COVID-19 be, if I'm gonna be redrafting the COVID-19 case, the situation can be adapted forever in my, I just wanted it to be forever on my, because there could possibly happen, this could happen again. This kind of situation could happen again. So this can be, can be covered on our contract. I mean, forever as an additional to the regular contract, right?
Yes, it's up to you. So you could incorporate it into your normal contract and make it a policy you're going to have, if COVID is, as long as COVID is still around, you can make it a separate document. It's up to you how you want to do it. I mean, if we don't have questions, does anyone want to share like how things are going right now with families and what issues they're confronting related to COVID?
I would like to share something, Nevares.
Yes, go ahead, Elizabeth.
With us as a provider, there's just so much that we do at the house. Like at my house, I tried, like my kids weren't going anywhere. We're staying home. We're spending most of the time at home. But then again, we are positive, you know, and when we spoke to the parents, tell the parents, make sure you stay home, make sure you do this. We know our parents and we could tell which parents are like following and which ones are not. How do we do that? I mean, how do we deal with parents like that? That you tell them you need to wash your hands. Oh, but we just washed them at home, but you need to wash them again. I mean, it's just hard for some parents don't understand how hard this is, you know, for everybody.
I know. I don't have an answer to that. I mean, I know for my sons, I have two sons, one's 3, and he goes to preschool, and they're constantly sending us emails reminding us of the rules, you know, like, again, you know, no one can enter the facility without washing their hands. They do have a hand washing station outside of the building. But yeah, they're constantly, like, every week or so just sending an email reminding everyone. But yes, you're right. I mean, the families have to take ownership too.
Yeah, and as Ritu mentioned earlier, with the sample contract, we'll send out a sample pledge that the parents can sign, letting them know some of these more specific things that you'd like them to kind of promise to do, like maintaining distance when they go outside of their houses, washing their hands more regularly, and just maintaining some COVID precautions. Again, as Ritu mentioned, it's not necessarily a useful document for for any kind of lawsuit, but it is something that is putting the parents on notice for what you're expecting them to do and making it more clearly defined. So we'll also include that when we send out those documents as well. So I have a couple hands up. I have Ashley who put their hand up, and then I have Carla after that as well. So Ashley, if you want to go ahead.
Hi, yeah, I am an executive director of a preschool in Encino, and we closed from March until June until we got some real strict guidance and we were able to feel like we kind of had a handle on things. But again, I kind of echo what Elizabeth was mentioning earlier is that like we really try to like remind parents like when you travel, like please be gone for 14 days. And I'm glad that Los Angeles County and California actually put it into effect because I feel like even though we were saying to do it, nobody was following it. And we had a family who went to Ohio because they're moving to Ohio. And so of course they had to like travel and try to figure out, look at the house and all those things, but they all tested positive. And then they were at our site for 2 days. So luckily, you know, it didn't spread because we're doing our jobs properly. So it didn't spread at all, but it's been real tough. And, you know, with parents almost blaming us like it's our fault. And we're like, listen, we're probably sticking closer to the protocols more than you are. But at the same time, if you're going grocery shopping, you can get it and be unaware, you know? And I try to remind families of that. Like we can go to Target and get it at Target with a shopping cart. And we can, you know, even if you order food, what if the person that is doing your Uber Eats has it and is unaware? So we're trying to show grace, but I just wish that I wish that we had parents would understand how hard we're working because I feel like they don't. I think that some of them are taking us for granted in a way. Does that make sense?
Yeah, I completely understand. And it's just frustrating, and I'm sure more so for you, of course, for all the people providing childcare. I just don't know what the options are other than like if you catch them violating the rule, terminate the care, which I know no one really wants to do. Education, like, you know, constant reminders and like basically honing in on the importance of doing all these things and why, like, it's, you know, people may think, like you said, it's just an innocent trip to the grocery store, ordering food, but it's out there and you just never know. And we have to keep the families in the program safe and everyone safe. And so, but other than those things, I don't know what else you can do, because a lot of it is on like our honor and people, like, you know, thinking of the better, you know, the whole community and putting the community like over their own like self-interest.
Yeah, that makes sense. I think just maybe reminding them that, you know,
Yes.
in the same way that you trust us, we're trusting you to be safe,
Yes.
you know? So
Yes.
I think
Yes.
maybe we just kind of have to remind them of that.
Yeah, and just, you know, find something that resonates with them and just keep reminding them. Like I was saying, my son's preschool, every week we get an email like reminding us of the rules, because even, you know, a lot of us we're well-intentioned, but like we'll go to school and then we like get caught up chit-chatting with someone and not keeping the distance, or, you know, you rush in, you forget to wash your hands. So like they just constantly remind us that these are the rules and they're in place for a reason.
Thank you so much for sharing. Carla, I have you in the chat that you would like to share something. If you can go ahead and unmute yourself as well. Thank you.
Yes, hello. It kind of has to do with kind of what Ashley was saying. I own a family daycare, and a lot of the parents I notice travel. They go to Las Vegas for the weekend, they go to San Diego, and I feel also, like she said, they're taking us for granted because they know what's going on. I do remind them, you know, don't forget about what's going on. And then, you know how in different counties, there's kind of like different rules, like in Orange County before they open before LA, and then Ventura County. And I have a lot of moms that would go to Ventura County just to go to the beach or to go to a restaurant. And I would have to remind them and be like, please, you know, there's other kids around, you know, I'm in danger, everybody. And they still like whatever. And that's frustrating for me.
Yeah. Yeah. It's really selfish, and it's very, I can imagine, very frustrating.
Yeah, so what I did, I started kind of like printing out on my own, like on Microsoft Word, kind of like rules, you know, please be mindful of traveling, stay home, try not to go out. I mean, it's really hard, and I understand, because for me too, I want to go out, you know, I want to, but I have a family, I don't want anybody to get sick. So I kind of like put it on my door, and the rules and the mask and all that stuff. So they're kind of thinking of it more, but there's still like one or two that is always like, oh, I went to Vegas with my boyfriend. I'm like, oh my gosh.
Yeah.
Yeah, I just wanted
Yeah,
to
I mean, I think the constant reminders help also, because as this has gone on for so many months, as you read in the news, like people have COVID fatigue. They're just kind of like going back to their old way of life, sort of forgetting that this is going on, especially if no one near them has been impacted. So I think the constant reminders about like how it's still very much like out there, and how, you know, they need to do this or that, I think that can help. But yes, it's so frustrating, because some people still kind of believe that it's just like a hoax and it's not really real, or it's not that dangerous, and it's really hard.
Yeah. Thank you for listening to me.
Thank you so much for sharing, Carla. Tom, you have your hand up. I'm not sure if that's from before, if you have another question.
Yeah, the question is, well, we wouldn't get sued from LA County Public Health, but well, I hope not. But what is their role in terms of helping providers follow the guidance? And then if they came out and deemed something inappropriate, and parents got wind of it, then could there be liability there, or how would that work?
I mean, from what I've heard from them, I haven't talked to them in a few months, or from licensing. Last I talked to licensing and the LA County Department of Health, they weren't going to be going around like finding providers or citing them. They want providers to follow these rules to the best of their abilities. They understand, you know, obviously with young kids, it's hard to keep them apart and hard to make them wear masks all the time. They get it. So it's not like they're going to be like policing every single thing. But yes, they do want you guys to try to comply with these policies, because it does help spread the you know, help contain the virus, and it's the right thing to do. But like if a parent were to sue, I would think, yes, they can use it as evidence if you weren't like following a lot of the rules. They could say in their lawsuit, like, this provider wasn't doing this or that, and they'd be, they have to show evidence of that. So if I were a provider, I would definitely try to follow the rules to the extent I can, because that's like showing reasonable care in this situation. But I don't think County Public Health or licensing is going to come out and cite or fine you for not following everything. It's more of like just doing it because it's the right thing. And also because, yes, if you were to get sued, a parent could use it as like evidence against you.
And are you guys aware of any providers being sued in LA County or otherwise
No,
due to COVID stuff?
I'm not. I have not heard of anybody. I mean, no one's come to us saying, yeah, I haven't heard about it in the news. The only COVID lawsuits I've really heard of so far are employment related. I think where employees are getting sick on the job. But sometimes a lot of those situations, if you got it on the job, it's covered by workers' comp. But I have heard some of those lawsuits, but I haven't really heard of parents suing daycare providers or even of people suing like other businesses where they went like in a restaurant or something. I haven't heard too much about that either.
Thank you.
So I think we're getting close to the end of the presentation and question time. I'm not sure, Ritu, if you wanted to close us out or if Alyssa had some last things to close out with, but I also just want to thank everybody for attending and asking some very thoughtful questions so that everyone gets the information and also sharing your experiences so that we are, we want to be better informed and hear what's going on with you all so that we can also think of ways to provide services as well. Thank you.
Yeah, I mean, I just want to close out by, again, reiterating that, we're here for you all. We value what you do. We know how hard it is and how important it is. And we provide free legal help to, child care providers that qualify for our services. Please don't hesitate to call our intake line. We respond pretty quickly. We can help with a lot of different things. And even if you don't qualify, I'm always happy to talk an issue out with you. So please do reach out. We will be sending a sample contract with the COVID provisions in the next few days, and it'll be distributed to you all. And thank you for attending, and thank you for sharing your stories.
Yeah, I just want a big thank you, shout out to Dee and Ritu from Public Counsel for taking the time, and for you all at the end of a long work day for being on here, being present, being engaged, and asking really great questions that help us better help you. So like they said, they're going to send me the slides and the samples, and I'll push those back out to you. Also, please take the survey because there may be other topics that Public Counsel can present on in the future. So we'd love to know what is of interest to you. And just as a final, I was on a call with the DPH and other COVID response people this morning, and they were really emphasizing that DPH and CCL want to make sure they know that they're not out there to fine you, to cite you for COVID related stuff. They really wanted to push that message out. So I was really glad somebody asked that question because that's not why they're there. Licensing wants to help, DPH wants to help and make sure everybody's safe. And that's really the end goal. So they're not out to get you. They just want to make sure that they can support you as needed during this time. That's it. I hope you go have a lovely rest of your evening. Stay safe, stay healthy, have a wonderful holiday season.